My name is Nalini Rajamannan, and I'm a cardiologist. I work out of Sheboygan, Wisconsin in my private practice, and I have a visiting scientist position at the Mayo Clinic. The topic of my presentation is the role of lipid lowering in patients who have mild aortic stenosis and elevated low-density lipoprotein levels. It's a sub-analysis of the SEAS study. So calcific aortic valve disease for centuries have been thought to be due to a degenerative phenomena, and the cellular mechanisms have only been teased out in the last 20 years. And in addition, epidemiological risk factors have also been identified which are similar to atherosclerosis, such as elevated cholesterol, hypertension, male gender, postmenopausal women, and renal failure. So there have been 4 randomized studies to date looking at the effects of lipid lowering in aortic stenosis, and all of them have been negative. I was blessed enough to work with the SEAS investigators, and we did a sub-analysis on the SEAS study and looking at patients who had very mild aortic stenosis and moderate to severe aortic stenosis. And then within that population, we looked at the patients who had a spectrum of LDL levels at baseline. So we went from lower LDL concentrations and separated them out into 4 quartiles and high LDL concentrations. And in this post hoc analysis, what we've discovered is that patients who had mild aortic stenosis and very high LDL levels that were randomized in the SEAS study had a definite slowing of progression of the aortic stenosis, and that the patients at the other levels of cholesterol, whether it was the first, second, or third quartiles, which are the lower levels of cholesterol at baseline, and whether they had mild or moderate or severe aortic stenosis, derived no benefit from the simvastatin ezetimibe. So in summary, it's exciting that there is a subgroup of the SEAS study that actually derived benefit from the medical therapy, and hopefully in the future this will lay the foundation for clinical trials in looking at patients very early on with disease and very high LDL levels, and then trying to sort out with a longer time period and proper clinical trial design if they should benefit from medical therapy.